Go ahead. Go
this
ahead.
is a topic that I'm very passionate about, not only as a nurse, but as an individual that um, likes to make sure that people are covered because we can't go without being covered with some kind of healthcare coverage. So, can you see my screen?
Yes, thank you. Now we see
Okay.
it. Yay.
All right. Yay. All right. So, I am going to talk about impact health sharing and health sharing, what the concept is, because a lot of people, it's relatively new in a lot of people's vocabulary, but you're going to be hearing more and more about it. Okay. So, because of technology, of course, as we said, the way we are doing business is changing. Just like Jennifer said a minute ago, how, she used to sell healthcare insurance. And just like we used to hail a taxi cab, the yellow taxi cab. But now it's hard to find a taxi cab if you really want one. There's Uber. And so healthcare is no exception. You think about the days of Blockbuster, we now have Netflix. The hotel industry, we've got Airbnbs. Toys R Us, we have Amazon. I think you get my drift. Things are changing due to technology. I'm going to start out with a quick video from the CEO of our company. And he is awesome. His name is Phil Chrysler. He's going to give us a quick overview before I take over. Okay. So here we go, Mr. Phil Chrysler.
Hi, I'm Phil Chrysler, President and CEO of Impact Health Sharing. Healthcare sharing began in churches. You were asked to contribute to help Bob and Sue with their ailment. People passed the hat and you contributed what you could to help your fellow member in need. Then, fast forward, you saw great things occurring in the Amish and Mennonite communities doing exactly the same thing. Then it got a little more formalized in the 80s with some religious-based organizations. And then the Affordable Care Act came along. That's really what propelled healthcare sharing to its modern day growth. You remember the individual mandate penalized you with a tax if you didn't have health insurance. But if you were a member of certain healthcare sharing organizations, you didn't have to pay that. Now we know the individual mandate has, of course, been reduced to zero. But in the meantime, healthcare sharing grew over 1,000% in the last decade alone. Why? Because it's an alternative to the high cost of insurance. Typically, you'll pay 30 to 50% less. Some reasons why: we're not for profit. So we have no profit motives that typically cause conflict between members, providers, shareholders, and the executive team. None of that exists with healthcare sharing and certainly with Impact. You can stop overpaying, my friends. Here's an important statistic to understand why. Department of Health and Human Services says about 5% of the population account for nearly half of the healthcare spending that occurs in this country. Majority are healthy. They're overpaying, though, for the non-healthy. Insurance has become really no longer affordable. 80% of U.S. adults rate lowering their healthcare costs as their top concern. So why Impact? Well, we're rooted in the love thy neighbor approach, which allows us to welcome all races, all religions, all colors, all creeds. We were the very first healthcare sharing entity to launch this patented technology platform that really provides 100% transparency. This had never been done before in healthcare sharing, certainly not in health insurance. We have member-owned accounts. That way the money stays in your account. We have no network. You get to see any doctor you want. Again, providing full transparency on how all the money moves is something we're really, really proud of. And of course, you have no open enrollment restrictions. Membership begins the first of every month. You just got to finish that application by the last day of the previous month. We also have great pricing and programs for individuals, for families, for seniors, and for groups. And remember, friends, it's a comprehensive program for your health. So we have preventative services, maternity, accident, illness, and of course, injuries. You have access to telemedicine and an industry-leading prescription drug pricing program. Here is a quick video that highlights the opportunity for all of us to be a disruptor in the industry. Enjoy.
Healthcare spending made up 5% of total US GDP in 1960. In 2020, spending hit almost 20%.
National polls show Americans believe healthcare prices and drug costs are among their top pocketbook concerns.
Over the past 20 years, the runaway cost of health insurance has outpaced earnings and inflation, leaving our families with less freedom and less money. Families, small businesses, and individuals alike are struggling to find a way to pay for the health care they can't seem to afford. So how are we going to solve this problem? All over the world, technology is changing the way people and society connect and interact. The result? Countless industries are disrupted. But while the rest of the world has changed, insurance and the way we pay for healthcare remains broken and largely the same. What if there was a way we could all pay for healthcare that simply worked better and felt better than insurance? Well, today there is. We are Impact Health Sharing. We are a network of families, individuals, business owners, and small entrepreneurs who want to see the old way of doing things change. We use technology to connect tens of thousands of individuals and families across the nation to simply share and pay each other's medical bills. Old problems can be solved when people come together to leverage their sense of community with technology to control the cost of healthcare.
My friends, what we are simply doing is leveraging your sense of community with technology to control the cost of healthcare. I hope you'll join us. Next, you'll be introduced to our marketing partner, ACN. You will see an exciting suite of essential services that are available to you. Thank you for your time.
Okay, what is impact health sharing? Works better and feels better than insurance. I'm going to show you why. Okay, here's some truths about healthcare. And these are truths I know very well. I've been a nurse for a long time. I won't tell you how long, but it's been forever. So like Phil said, 80% of the country is trying to lower their healthcare costs. There are people who are really struggling now, especially if they've either lost their job through no fault of their own, or they just decided to step away from it. So 5% of the population are responsible for 50% or more of the annual healthcare costs. That means that most of people are overpaying, just like car insurance. I like to make this comparison. Like car insurance, if you're in an area where a lot of people have a lot of claims, you may not be the one that are contributing to a lot of claims, but you're going to feel it when your rates go up. Over 100 million Americans are in some form of healthcare debt. And I will tell you this, and this is staggering, and it's so true, that the number one reason for personal bankruptcies is medical debt, because people can't help it. They can't pay it. So some of the benefits of health share programs, it's been around for over 40 years. There's a low monthly cost to it. It's affordable, much more affordable than traditional healthcare. You can save 30 to 50% on your healthcare costs. And what we do, we negotiate rates for medical and pharmacy services. One of the things that happens with Impact Health Sharing is that when you get a bill, they renegotiate what you are charged, and you are charged a lesser fee. So how many people can say that you have Aetna or Cigna or Blue Cross Blue Shield running interference for you? Going out there and saying, yeah, I know what the bill is, but this is what we're going to pay. Sounds more like going and buying a car, right? So this is the most modern and contemporary. There are no religious requirements. Like he said, when it first started out, there were some religious affiliations, but there are no religious affiliations now. Provider bills are Impact daily, okay? And Impact negotiate your bills for you. One of the things that we have found out too, the providers who have had to have patients who have impact health sharing, they love it because they are paid 15 days or less. And you will hear a lot of doctors say, I'm having trouble paying my bills, my own bills, and paying my people because, they bill the insurance companies, but the insurance companies pay them when they get good and ready. Okay? So, what do most people want? They're looking for something that's affordable and affordable copays and affordable deductibles. You can pick your own doctors and facilities. How often do you hear people say, you know what? I had this doctor and I love the doctor, but it's a new year and they're no longer in my plan. And so I can no longer go to them. So there is no network. Okay. And employers want to offer healthcare options. And we do offer that for groups. Okay, so why impact health sharing? Like we said, it's comprehensive. It covers everything. You can pick your own doctor and facility, nationwide access. And we've heard of people who have, they've had some illnesses, they want a second opinion. They may want to go to the Mayo Clinic. If you want to go to the Mayo Clinic, you can go to the Mayo Clinic. You're not going to have one of the big insurance companies say, deny, deny, deny. It's not medically necessary. There's free concierge scheduling that's coming soon. It is here now. And what that is, if you have a provider and they don't know about impact health sharing, they can get in touch with Impact Health Sharing, and Impact can go ahead and take care of it before you get there. Okay. There's unlimited telemedicine. I don't know if you've used telemedicine before or not. It's wonderful. For a lot of things like a cold or something, you really don't feel like you want to go to the doctor in person and sit in a waiting room. It's wonderful to just use your telemedicine provider here, and they're available 24/7. Okay, it's great for if you have children also. You say, my child's been sick. I really don't want to take them out. Somebody will call you back within about 15 minutes. Okay. Great RX pricing for your medications. And our premiums start at $73 for individuals, up to $378 for families of 3+. And I'll tell you, we say 3+ because you can have 3 people, you can have 5 people, you can have 10 people, and you're still going to get the same rate. There are free dental and vision discount cards, household PRAs, which a PRA is synonymous with a person's deductible. Okay, but in our terminology, because it is not insurance, it is an insurance. What do I want to say? It takes place of insurance. Okay, it works like insurance, but you can't call it insurance because it's not insurance. Okay. So household PRAs, which is a deductible, is as low as $2,500 a year. And that is for the household, not per person in your house. There are whole health and wholeness credits, which I'm going to talk more about. It's very exciting for people because people do want to stay well. And it's available for migrants, okay, they have an ITN number for Canada, US, Guatemala, and Mexico. Okay, go past that. Okay, who is our targeted customer base? So individuals and families who are overall fairly healthy, who are currently paying some or all of their healthcare costs. Okay, in total, about 91 million people fall into 3 different categories. Okay, there are non-group companies or self-employed people, independent contractors, which most of you are on here, gig or part-time workers who don't traditionally have an employer through which they get insurance. Those who have some insurance, but they're underinsured. And then the third category, those with no insurance at all. And because of the world we live in today, there are a lot of people who are dodging the bullet and are going without health insurance because they've been priced out of it. Yeah. So we can give quotes for businesses to small businesses with 49 employees or less. So we can take care of those groups. And if you do have a group that's over 49, the company can work with you on that also. So no participant minimums, and there are no contracts. Just like he said, if you apply and you sign up by the end of 1 month, at the beginning of the next month, you're covered. And if you want to leave, you can leave whenever you want to. So there are no long-term contracts. So experiencing turnover because they don't offer healthcare. How often do you hear people say, I cannot keep people? I had some good people, but they couldn't afford to work for me anymore because they needed to go to XYZ because they were offering them health insurance. So this is helping small businesses a lot with that. There are monthly ACH withdrawals, just like anything else that you have automatically withdrawing from your account. So you don't have to worry about it. You got it set up and they'll just do that withdrawal and you'll know what it is every month. And you have a portal that you can see exactly where your money is going from. There's an average of 40 to 50% savings in what you're going to be paying. And we continue to support and add new members. Yeah, we have about 18,000 members right now. Yeah. Okay, so here are the guidelines here. Okay, they're simple, they're straightforward, and I'm going to tell you how to get to my website so you can see it. And if we have time, I'll show you that. Okay, it's all about ethics and honesty. And like he said, we're not for profit, so we don't have an incentive of we need to make a lot of money, so we can pay for the big bills, big buildings, and big salaries. So pre-existing medical conditions are conditions you probably heard about before, which known signs and symptoms, testing, diagnosis, treatment, or use of medication occurred within 36 months prior to membership. Okay. If it's been longer than that, then that's not a problem. Does not mean you can't have it, but there are certain things that would not be covered. Okay. Now, this is something a lot of people are interested in because we have a lot of people who have high blood pressure or high cholesterol because this is the world we live in. So those are not considered a pre-existing condition for purposes of determining eligibility for any future vascular or cardiac events, which is great. And for seniors 65 and over, there are no pre-existing conditions. So they do recognize as we get older, our bodies get older also, okay? So I can give you a quote. We do a quote by age. And for 65 years and older, there is an individual plan. It's a flat rate. The PRA or deductible is $1,000 for the year, okay? One time every year, once a year. Co-share, which would be a co-pay in the world of insurance, $0. And for here, the price is $100 for this person, okay? You must have Medicare Part A and Part B, okay? And the age factor's price is $1,000 PRA, no pre-existing. I'm just repeating here, okay? I have it, and I love it because what it does, it serves as that gap that, Medicare pays 80%. Then you still have a gap that you have got to pay. And Impact fills that gap for you, okay? And here is an example here of reference-based pricing. And this is simply when Impact has gone in and run interference for a person. And this is a real person. Everything is blanked out. This is a person that they had to have service, and they do have Impact care. Okay, their service date was June 23rd, and they received their bill on the 17th, okay? So what happened was they were charged $200,000 and some change. When Impact renegotiated that, it brought it down to $179,840. Okay, what was shared was paid then, and then the only thing that the person ended up having to pay out of that initial $200,000 was $6,000 and some change, $6,517. Because what it is, after Impact has negotiated your pricing, then what they do is they go into the sharing, and we all share into that. And you can see in your portal exactly who you helped pay for. Okay. So they ended up, so it's a lot better to pay $6,000 versus $200,000. I think most of us would be ready to pass out if we got a bill for $200,000 if it was not covered. Okay, here's a comparison here between traditional health insurance and impact health sharing. Okay. With traditional health insurance, you have high monthly premiums because they have to pay those big corporate salaries and those big, beautiful buildings. Okay, in impact, you have up to 30 to 70% savings per month. Now, one of my co-workers, business people, he's a gentleman who he has never had a job. He's always been a businessman and had to pay for his own health insurance. He has a wife and he has 3 boys, and he was paying almost $1,800 a month for his health insurance. With Impact, he is paying $513 a month. Same family, same family. Okay. So yeah, makes a big difference. And his doctor that he went to, we just seen a video where she's ecstatic because her bills get paid very quickly. She said, you know, I got paid in 15 days. I never get paid that quickly. Okay. So doctors love it. Okay. There's a high deductible per family member with traditional health insurance. With Impact, it's for the whole household. It's for the whole household. So per member versus household. Okay. All right. With traditional health insurance, you have to choose a specified network, and you have to stay with that until it's open enrollment. Okay. And your network may switch. Okay. With Impact, you choose your own physician and facility where you want to go. You're not stuck with a network. Okay. You get RX pricing here. There are certain drugs that if they're under $10 that you don't have to pay for. Okay. So it depends on what you're on. Okay. So with Impact, there's lower RX pricing, and you can check that out in your portal. With traditional health insurance, there are higher co-shares, co-pays, and provider fees. With Impact, lower co-pays, co-shares, and provider fees, because there again, we're not having to pay big corporate salaries because it's not for profit. Okay, there's extra costs for telehealth, or that's not available with traditional health insurance. And this is part of what you get with Impact Health Sharing. And it's available to you wherever you are 24/7 with no additional cost. Okay. And income determined for your traditional health insurance, and Impact is not based on income. Okay. And here is a sample of what the discount looks like. Our discount for vision and dental is through Carrington. It's very nice. It's very nice. And so this gives you an idea of what the discount would look like. Okay. Those are testimonies. Okay. Okay. I don't want to give you all that. Okay. Your quote. Okay. What I would like to do with this, let's see here. I'm going to try to show you my website here. So I can show you how you can go on my website and get a quote. Okay. And what we do with the quote, let me get my website here. And you still see my page, okay? All right, very good. Okay, so you look up here. This is my website, margaretbroadus.acnibo.com. Okay, it will take you to my website here. We're going to go to services. We're going to go to residential services and healthcare. And we're going to impact. And it will take you there. And it costs nothing to get on here, browse, and you can get a quote. So what you would want to do is get down here. And
Could
so
you put that link in the chat for us?
Yes, I will do that.
Thank you so
I
much.
sure will. Yes, I sure will. So what you would do, you would go on here and you would do get my quote. Okay. Let's spell again. Okay. When you get on here, what you will want to do, say there are 3 people. Let's say there's 4 people just to make it exciting. Okay. Let's say there are 4 people in your household and say the oldest person, their birthday is, let's say they were born in March. Okay. Let's say they were born in, let's make them old enough. Okay. Let's say they were born in 1973 on the 3rd. So they were born March 3rd, 1973. Okay. So we said they had 4 members. So you can get it for 1 person, 2 people, or 3 plus. So as I said before, 3 or 10 is going to be the same. Okay. Well, let's say we're going to get for 4 people. So this would show you right here. So just like traditional insurance would be, this with the PRA, your monthly premium or share would be based on what you want your PRA or your deductible to be. So for instance, if you wanted, just like with car insurance, I always make that reference because I always think about that. Okay. So say you want a lower primary responsibility. Okay. Monthly cost would be $628. And that would be for the 4 people. Okay. If you wanted a different deductible, then it's going to be a little cheaper. And the higher the deductible or PRA, okay, then the lower the cost. You determine that, as you know your needs more than anybody else. Okay. But this is how you get a quote. It costs nothing to go on here and just look around to see what all you get. One of the things that's really exciting about it, especially in our day and age of we really want to catch, mental challenges, because I think we all have some mental challenges, or sometimes we just need somebody to talk to. We also have virtual teletherapy, which is great too, which is great. You're just not feeling good, or you just need somebody to talk to. It's available also. Another exciting thing is our annual wellness rewards to you. Say, for instance, there's someone who likes to go to the gym, or they take supplements, or they go to the chiropractor, or they have acupuncture. You get up to $150 per month credit, and it's a buy down from your annual premium, which makes it nice. So say, for instance, if you chose, if you chose your deductible here at 2,500, okay, it's going to go down by the $150 every month. All you have to do is you upload your receipts up into your portal, and it takes it right off. So that's an exciting thing about it. But yes, I will put that in my in the chat down here. So let's go back here. find my slide. Okay. All right. So there we are. So yes, let me just go here. Slide. Slide. Okay. So yeah. So here is a QR code here. And as you already know me, I'm more than happy to share this with you. So we are joining a crusade. I'm going to stop sharing here. Okay. Okay, that's still up there. Okay, yeah, stop sharing. Okay.
You did well. You did well.
Yeah. I get excited about this because there are so many people who lose their homes or lose so many things, like I said, or just have to file bankruptcy or go without. And no one should have to go without healthcare coverage because it doesn't cost that much. But, anything that you can do to stay healthy, that's what Impact wants to do. That's why you get that $150. And this is for your household because your PRA is for your household. It's for those every 4 people, which you just don't find that any place. So yes. So I will entertain any questions that you have and would love to meet with you at any time too. It's like, as Jennifer knows, I don't sell, I share with people because this is exciting. And I think that it's my duty to share information. And any kind of information I have, I love to share with people because I always hope people will share with me also when they know some things that could help us all. Because in the end, it helps all of us if we can stay healthier and make sure that we're able to go to the doctor whenever we need to, or you need to take those supplements, or you want to go to the spa, or you need acupuncture, or you need to go to the chiropractor. That's exciting.
Margaret, is this in all states or just Indiana?
It's in all states. I think the only state is Rhode Island. Yeah.
Okay.
Yes. But yeah. And the thing about it is, I was going to show you the card.
I have my son's over in Illinois and he doesn't have any health coverage.
Oh, absolutely. You need to, when I put this in the chat, have him go on here, and I would love to get on a Zoom with him or anything. And, I was going to show you my card. I don't want to take up too much time, but your medication, your healthcare card is just like anybody else's card. And when you go to the doctor, you show your Impact Health Sharing card. If you show it to them, they go, I've never heard of that before. You say, there's a number on the back if you would like to call, and they can call. Yes.
If I can just throw that out there. I mean, Margaret is very good at what she does and shares and makes you feel, but I'll tell you, when I've called them a couple times, and I was just looking back before we got on tonight because I wanted to make sure because if we had any questions, I forgot about the chiropractor. But there's also, there's just some of these things. And I think if you call them, I have a couple emails where one of the ladies at Impact sent me a bunch, and she was just like my best friend, or a friend. So but it's a whole different kind of, I think you just have to put yourself in a different place mentally. You just have to think different.
Right.
And if I can just say, what was I going to say? Oh, and I don't even know.
About the healthcare card, maybe.
Well, the healthcare card is pretty, and there have been some things that I've actually done better with my card than you have, maybe, or whatever. And he's on Medicare, but it doesn't matter. But what was the other thing I was going to say? Oh, I just know the number that we looked because Philip was going on Medicare a year ago.
Was it Medicare Advantage?
He's on a supplement. He's not on an Advantage plan.
Okay.
You know what I mean? He's got but anyway, the reason I brought that up though, the number we were looking at, it was like, you got to be kidding me. Then we looked at Impact Health, And it was probably, I think, did they say on there somewhere between 30 and
It could be
50%?
30 to 70%. It depends on what you've had and what you're looking for. Yes. Yeah, there's definitely a savings because it's a whole different culture
Right.
because it's not for profit, which makes all the difference in the world. Yeah.
So even before I met Margaret, although I've known Margaret for a while, but before I quite understood, I'd heard of medical, health sharing. I'd heard of it, and it started in the church
The church,
organizations,
yes.
and
Mhm. Yeah.
so I mean it was intriguing to me. But when you started, I got to know more about that. And coming
Right.
from the health insurance world, it's
Yeah.
just taking me a while to kind of get it in my brain differently, but
Yes.
that's a wonderful thing.
But see, that's why we said it's been around for a long time, and I had never heard of it until we did it, and then I started hearing about like Medishare and other things. As a matter of fact, person who was in charge of Medishare is now with Impact. So, right, because they had those other restrictions, the religious restrictions, and it's like with us is love thy neighbor. Come one, come on. It's like everybody needs to be covered. So it has nothing to do with you need to be a Catholic, a Christian, you need to be whatever. It has nothing to do with that at all. No.
Right. Very
But,
cool.
but no, it's been around for about 40 years. And like I said, I had never heard of it until Impact came along. Yes.
And if
And yeah.
you can do that, Margaret, put your
Yes,
site
I will
link
do that.
in there.
Yeah.
And then I don't know, anybody else got some good questions? I mean, I'm saying good or whatever
Or
questions.
just questions,
Just
whatever.
questions.
Yeah.
I don't know if any of them are better than others.
I think it was very informative. I'm excited to dig around on the website a little bit and
Well,
see.
yes, yes, by all means. And any questions you have, I will put my phone number
Thank
down
you.
too. Yeah,
Like I say,
because it's like, the more people who can find out about this, you see, make sure, yeah, yeah. And just, navigate around there and just, let me put my phone there.
thank you. Philip has what we can say?
As a question?
Yeah.
Yes, but he.
How are the dental and vision plans compared to like United Healthcare? Since I'm on Medicare, but I don't have that. I got to go through United Healthcare to get it. How do they compare? I mean, do you get like free cleaning or?
They're discounted. They're discount. I could. You said I was going to try to go back to that. Yes, because it's discount, but it's a pretty hefty discount. Yes. Mhm.
So when you have this, you should, because I've gotten probably more than, and I'm not trying to tell anybody how, but I've gotten people like, is this kind of a different kind? In some, you have to educate them. You have to tell
Yes.
them, and so it's not. But what was I going to say? There was something there, but the discounting is, I think you just have to be very, you just have to understand that what you're sharing, they might not know yet, but you might be
Right.
the one to share that with them.
But
And
yeah, with Carrington, there's a whole list of providers that you can go to, which is nice. And so you can call and find out, what they would charge. But
see,
it will show
that
you.
right there, maybe, see, you're telling me things that I'm like, oh, that's right. Like the
Yeah.
chiropractor, Carrington, why am I not looking on the list of, it's just a
Right.
different kind of way to think of things. I just haven't done it.
One more.
But see, that's the world we're in now. I'm sorry, what'd you say, Philip? Yeah.
Are you're on Medicare yourself, and you do have are you paying a full amount of like she pays maybe $300? Are you paying that same amount? And you get, is it, how do I want to say that? Is it cheaper to go that route than going through your supplemental on Medicare?
Absolutely. Yeah. I had United Healthcare Advantage, and because I had the same questions you did. And I found that because it was Advantage, there were a lot of things they weren't covering, but they were charging me for. Where my impact when I go get blood work, when I go anywhere, I give them my Medicare card and I give them my Impact Health card. I give the two and no problem. Yes. So it truly is my supplemental. Yeah. Yeah. Because when just like all of us, we just think, well, Advantage, that looks like, boy, I'm going to get more coverage there. But when I had to get educated about it too, because I'm not an insurance person. But yes, it sounds good. But then when you look to see, and then they were telling me what meds I could take, or they charged me an arm and a leg. And it's like, wow, okay. I can either be sick or I can be covered. And that's why I like to share with people. And if it's something I don't know, I never have a problem going, I don't know, and I will find out for you. Yeah, because you know what? Everybody's getting older, and nobody's going the other way, getting younger. And so I think the more that we can help one another with getting educated on things, because it's new, just like we said. Whoever dreamed that, the yellow cab would not be around, people would call a cab. And whoever thought of Uber or Lyft or any of those things and Blockbuster, we things are changing for the better and they're not going back. They're not going back.
Right.
And so we are finding better ways to do things, especially with healthcare, because it is so expensive. And having someone who is going to run interference for you, just like, and I'll tell you one more story, but another one of my business associates, her mom she still is a cosmetologist. Okay. And of course, private contractor. When people come and they get, their hair done and everything, she gets paid. If they don't come and get their they don't come to the salon, she doesn't get paid. And she ended up with breast cancer about 3 years ago. And you know how right there you see dollar signs, dollar signs.
Mm-hmm.
She got to go to every place she needed to go. She had her surgery, she had her reconstructive surgery, and yeah, got her cancer taken care of. And she didn't have anyone saying, well, no, you can't go there. No, you can't do that.
Yeah.
Because insurance companies love to say deny, deny, deny. And most of us are not insurance professionals. And so we just go, well, okay. And we end up, a lot of people end up not taking the meds they need to take or going to see the doctor they need to take because they have to go, can I eat or can I take care of my issue? And that's not good for anybody. Yes. So yes, so I can ramble on and on, but I won't. But I welcome any of your questions. If you think of some later on, I put my phone number also in the chat. Okay. And I'd be more than happy to talk to you. And like I said, go on there, it costs nothing to get a quote, nothing whatsoever. And I will say, so if you have somebody in the household, say there's two people, okay, one of them is 65 or older, okay, they have one flat fee. So you don't count them in that who's the oldest person there because that's separate. Yeah. Because we only have $1,000 PRA. Plain and simple. Yeah.
What Philip was asking, when you have a pre-existing condition, what did they do? How did they look at that? And I think it's.
Yeah, you mean as a Medicare recipient or just people, period?
In general.
In general, yeah. The thing about it is, like I was saying, for like certain things, if that has been within the last 36 months and it's not resolved, that's called pre-existing. But if it's been past 36 months, yeah, it's no longer pre-existing. Right.
So and like I said at the beginning, Margaret knows her stuff very well, but she does not. She points you toward the right places. And I guess
Yeah.
that's, I'd like to think we all kind of do, we all should do that, right? Not that you can't, because you said right off the bat that if you don't know, you'll find out or you'll help us.
I'll always do
Yeah.
that. Yes.
So, yes.
And on my website, if you go through there, like I just showed you, there are guidelines there too. So I mean, it has so much information there. And then also you can just fill in your information there and they'll call you back if you have questions. Yes.
Okay, very
We
cool.
want to make sure people are informed. Yes. Did you say something, Don?
Yeah, I had a question.
Sure.
Health savings plans. I
Yes.
know with traditional health insurance, companies also offer that you can have a health savings plan that covers health-related incidentals, that you can put that money aside and it be tax-free, and you can utilize it, within the calendar year, or sometimes it rolls over. Is there something under the health sharing plan that is like or corresponds to a health savings plan?
I do not know that, but what I would say is what I would just think, but what I would want you to do is fill out the information on that site and they will answer that for you. They'll call you right back and they would answer that for you. I don't know if they would say, use your health savings plan, but Impact could be a supplement to it. And so together, yeah, because Impact is it's gonna help you no matter what. Yes. No matter what you have there. Yes. Because it fills in that gap. Yes.
And with the traditional health insurance, I know, whereas I have the opportunity to, I'm going to contact my health insurer and ask them if XYZ health service that I'm about to engage in is covered.
Yeah. Right.
And of course that directs, my ability to
Sure.
schedule a particular exam or go to a particular location.
Right.
So with the health sharing, do you do the same thing? Is there a resource that you call and say, is this covered or not?
Yes, you could. And like Jennifer said, there's so much information. I'd go to that website, my website that I showed you, and just keep scrolling down there. And there's a place for you to fill in the information. And they'll call you right back. They're not going to try to sell you anything, but they would answer you. All those questions, because they do tell us don't try to be the expert, which nobody has to tell me that because I'm a nurse, I'm not an insurance person. And so they have very very knowledgeable people there, and that's what they're there for. And they would be more than happy to answer all those scenarios. Yeah.
Okay.
Yeah.
Thank you.
But those are good questions. Those are good questions. And I would be interested in hearing what you found out. Yeah. So then I know too, because that to me is what knowledge and education is all about. That we share it. Yeah. Good question. Any other questions? Yeah.
Yeah. Anybody else? I mean, obviously, you know how to get a hold of Margaret, or you should.
Yeah. I got the number out there so people can. I do want people, it's not for everyone, but for people it is for. I want to make sure that they're not overpaying, but they've got good coverage. Yes.
Good.
Yeah.
Well, thank you very, very much. And we've been talking about doing this for a while. And actually, Margaret had done one or two TTR Presents before this and never really got to talk about this. She did a couple other, or you did the thing about, it was about this time 2 years ago, I think, that you did it. And I was looking back thinking, poor Margaret didn't even get to talk about what she does. She actually is, I think you did kind of, but it was the juggling theme, and it was this time of year a couple of years ago when you did that. So we thank you very much. I
Well, no,
will.
I love to share information. So yes.
Yep.
Mhm.
Well,
Yeah.
you're awesome at it. Thank you very much. It is a few minutes, not much, but a few
Yeah.
minutes after 8. And I knew we would have a lot of good information. So like I say, you all know, but her email contact information is in there, and is in the chat. And this will be on our YouTube channel. It'll also, I will send it out probably even in a blog with the link and everything, because you just never know. As we all know who are on here, excuse me, all of you know now. It might have been some stuff you didn't even know, and now you know. I forgot about the chiropractor. I mean, we go to the chiropractor. What am I
I was going
doing?
to say, Jennifer, how could you forget?
I did. I
Your
did, because I'm not,
chiropractor, yeah.
you know, and you kind of like, oh my gosh. My first thing, everybody, was that it was going to save me some money, us some money, and it did.
Yeah.
And it
Yeah.
did. But then you have to kind of learn how to use the whole thing, like anything, right?
Right. Yeah.
And they are very helpful. And Margaret is a good representation of how nice they all are too. So I would just
Okay.
encourage you. And if you have any questions, or you learned something,
Yeah.
Miss Dawn or Bev or Amanda, please let us know, because that's
Yeah.
pretty cool too. But thank
Right.
you, everybody. And thank you, Margaret. You're awesome. You're on.
Well, thank you for allowing me to do this. I love sharing, and yeah,
Well,
Thanks,
good.
Margaret.
fantastic. Yes.
Great
Thank
job.
Thank you all.
You all have
Thank
a
you all.
wonderful evening. Be safe out there. And I'm going to
Bye.
stop the recording, and then I'm going to let you all go.